using Kritik in my evidence-based practice and nursing research course. So this course is for sophomores, and the goal is to teach them the value of being able to find, read, and write about research, and then being able to use those research findings in order to apply to make evidence-based practice changes and understanding what the evidence-based practice for nursing really is. So a little bit about how we use this. So one of the things that happened is we used to have a TA for our course who did all our grading for us, and then we didn't have a TA anymore because they were needed to work elsewhere. So we had to kind of restructure and figure out how we were going to run these large courses with 40 plus students in each section and having a lot of manual hand grading, because this type of writing and learning to do this does not really fit well with a multiple choice type response, and the students really don't get anything out of it. So the other thing we noticed, though, was our TAs giving us feedback on how much they learned from grading, and that from grading those assignments, their APA improved tremendously, and they could now do it off the top of their head, having done all the grading. And that the research grids, like looking in the articles for those pieces, became second nature because they had done this grading. And so we really looked to incorporate that feedback into our new pedagogy of using peer review as a teaching strategy. And so rather than having to have somebody, spend all the time grading, the students do these peer evaluations. And not only are they, helping with that feedback to their peers, but they are also getting a lot out of it, because as they find peers' mistakes, they start recognizing where they have made mistakes and making those corrections. And so, because they're looking for what's correct. So it really does help a lot. I think Kritik being anonymous really helps a lot, because then the students feel like they have the freedom to be very honest in their evaluations and in their feedback. It really helps also learn how to provide constructive feedback to people when they get that review on their feedback of, did they actually hit those fine points of why they took points off, or did they just kind of gloss over it? And so that helps them with their communication skills and their writing skills. Again, the mastering those skills during the grading, and really, really having it hardwired on how to do these skills that we are teaching them, just the same as we teach them other nursing skills, the skills of finding, reading, and evaluating research. So that's also useful. The other thing I was going to mention, the evaluator notes, which have that detailed expected answers, those do not release until the assignment deadline has passed. And when we were using the other software and I posted those evaluator notes, I had to time them to release after the assignment closed. And because we have two sections merged together, we had to do exemptions and all kinds of special, programming in the software to keep students from seeing the answers if they were in the second section. So it's much easier in Kritik just to have click that button that says release after assignment.